From the PEP Radio Newsroom, this is the Hourly News Blast. Advocate is reporting the American Medical Association is rejecting claims that it has stepped back from support for gender-affirming care, saying its guidance remains unchanged even as political pressure and public confusion intensify. In an interview with The Advocate, Alex Sheldon, Executive Director of GLMA Health, Professionals Advancing LGBTQ Equality, said the controversy reflects misinterpretation rather than any substantive shift in medical guidance. We knew right away that any shift in policy that was being reported was a grave exaggeration, Sheldon said, pointing to GMLA's role within the AMA's House of Delegates, where it has a voting seat and direct visibility into policymaking. At the center of the confusion is a dispute between the AMA and the New York Times over how the organization's position was characterized. In February and March, the Times reported that the AMA had aligned with the American Society of Plastic Surgeons in backing limits on gender-affirming surgeries for minors, framing the development as a shift. The AMA later pushed back, saying that the interpretation overstated its position and that its policies had not changed. The newspaper, in turn, defending its reporting, citing prior AMA language, noting that such surgeries are generally deferred until adulthood. In a recent board newsletter, the AMA sought to settle the matter, stating that its policies remain unchanged and reiterating that gender-affirming care is medically necessary and should be guided by patients, families, and physicians rather than government mandates. The organization also emphasized that its existing framework continues to support access to care across the full spectrum of treatment options. The clarification followed weeks of scrutiny that blurred the distinction between long-standing clinical caution and a broader retreat that medical groups say never occurred. As previously reported by The Advocate, the AMA has acknowledged limited evidence around surgeries for minors and noted that such procedures are typically deferred until adulthood, but those interventions represent only a fraction of gender-affirming care, which more commonly includes counseling, hormone therapy, and social transition, all of which remain supported by major medical organizations. Sheldon argued that the nuance was lost in translation and then amplified. In this case, the New York Times relied on a quote that was itself sourced from another outlet, they said, describing an echo effect that distorted the AMA's underlying policy framework. That distortion, they said, has had consequences beyond the news cycle. In Washington and state houses across the country, policymakers have seized on perceptions of medical uncertainty to justify restrictions on care. The federal government is using its own power to try to undermine medical integrity, expertise, and science, Sheldon said. It's not based on evidence or science. It's based on their own ideology. And those efforts have also faced resistance in the courts. In one recent case, a federal judge in Oregon rebuked elements of the Trump administration's prohibition on transgender health care, siding with a coalition of states that challenged federal efforts to restrict access. Sheldon pointed to those legal outcomes as evidence that the broader medical consensus remains intact, even as political actors attempt to reshape it. The vast majority of them continue to stand up and say that that is not what science and evidence are telling us, Sheldon said, pointing to the AMA's clarification as reaffirming that gender-affirming care is medically necessary, evidence-based, and supported by the vast majority of medical organizations. And that's the News Blast for this hour. The PEP Radio YouTube channel offers news throughout the day. If you are watching our news videos on YouTube, please be sure to subscribe to our channel to keep informed throughout the day. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, and Alexa. Up next, we have the Meadville area weather forecast here on PEP Radio.